Hi my people, welcome back to my channel and thank you for liking, commenting and subscribing to my previous videos. If you're new here, welcome and please consider subscribing. Today we are continuing with our series of infertility and we have a special guest. She's called Dr. Maryann. She can introduce herself.
So thank you so much, Linda, for the opportunity to be on this platform. As Linda said, my name is Dr. Maryann. I'm a hospital pharmacist practicing at Medicatia Hospital, and I'm glad to be part of this wonderful initiative. I hope it's going to be impactful and we are all going to learn something.
Yes. So today's topic, we're going to talk about sexually transmitted infections, STIs, STDs and infertility. Yeah, because you realize, especially during this COVID time, there's been a lot of pregnancies with teenagers, and this just translates to the fact that people are actually having a lot of sex, unprotected sex. So we are here today to teach you about sexually transmitted infections and infertility. So if we start, what are sexually transmitted infections?
All right, so in a nutshell, sexually transmitted infections are the infections that are basically transmitted through sexual contact. And sexual contact can either be vaginally, anally or orally. So any infection or disease that is propagated through intercourse in any of those modes is a sexually transmitted infection. And there are many categories of the sexually transmitted infection, but when you look at the data that WHO gives us, when you rank them worldwide or even as a nation, they are predominant ones that usually occur most frequently, and they're the likes of chlamydia, gonorrhea, syphilis, and
HIV.
Yeah.
So those are just to mention the few. Yeah, so we go straight to the topic. So sexually transmitted infections and infertility. So the way she's mentioned, there are so many, but there are only specific ones that are related to infertility. Yeah, so if you can just give us those two, and then now we go down to them.
So the main common ones are gonorrhea and chlamydia. So those are the most commonly occurring sexually transmitted infection. And I think we could say also they are bacterial in origin. And you see, the reason as to why sexually transmitted infections is such a very pertinent and key issue is because most of these infections are usually asymptomatic. So you see, one could be having them and one just believes they're okay. But you see, as Dr. Linda says, our end goal is, do you want someone to proceed to having infertility so that you look at other ways of propagating the same or mitigating the same?
So we can look at, now you've mentioned a very good point that it's asymptomatic. So what do you mean by it's asymptomatic? Because I know there are many people who are watching me and they're not in the medical field.
All right, so something asymptomatic means you could be having the disease. The disease or the infection is in your system, but then you don't outwardly manifest the symptoms that are associated with the disease. I'll give an example. So when you're looking at gonorrhea, for example, one of the main signs and symptoms that someone may present with, for example, a lady, is an abnormal vaginal discharge. That's in terms of the color, the consistency, and even the odor. So for someone who is asymptomatic, that person has very normal vaginal discharge. There's nothing that could suggest her vaginal health is in jeopardy. She's just very okay. So she may tend to assume that this is my normal, I'm actually normal. So I mean, no, I couldn't be having chlamydia or gonorrhea. So that's why in 90% of the people, it's usually unnoticed. And you see, that's how they act as carriers and further on propagate
from one person to another. Yes, so now there are those that are asymptomatic. Now we can look at those ones that show symptoms. So that actually someone can know, hey, I'm suffering from gonorrhea, hey, I'm suffering from chlamydia. So we can look at now the signs and symptoms.
All right, so probably apart from the vaginal discharge, you could also give enough the matter.
Apart from vaginal discharge, we can have now fever. You can experience fever, though fever is characteristic of so many diseases. So many diseases you can present with that. Yeah. Then we have now painful sexual intercourse. So when you're having like sexual intercourse with your partner, you feel pain.
Yeah.
Then you can also feel pain during urinating. So you're going to pee and then you start feeling pain.
Yeah.
Yeah. So those are like some of those signs. Yeah. And then you could have also abdominal pain or pelvic pain.
Yeah.
Yeah. So by what I mean by the pelvic pain, it's just pain in your pelvic region, which is below this belly button. I'll call it belly button, yes. Below that, so you'll start feeling a lot of pain.
Yes.
Yeah.
So just to add something small to what Dr. Linda has said, especially on the aspect of the burning sensation when urinating, you see urinary tract infections also have the same presentation. So the signs and symptoms sort of overlap. So one really has to be very keen and careful. So immediately you experience, for example, the burning sensation when urinating, it's worth getting a further workup, because you see it could be a UTI, it could be an STI. You're treating a UTI while yet the STI is festering.
Still there.
So that's why it's really keen to know the normal your normal reproductive system and how you usually are when you're okay, so that once you notice something off, it's worth going for a checkup at the gynecologist probably.
And I always discourage people to self-prescribe, just because I have presented with a burning sensation when I'm urinating, then I go to see like a doctor, and they give me these drugs. Doesn't mean that when you present with the same symptoms, you'll be given the same drugs. No, that's why I always advise you, like even if you come to my inbox, you're giving me your symptoms, I'll not be able to do a diagnosis without sending you to the doctor for further tests. So it's really important that you go for further tests.
Absolutely.
So we can look at, now we've looked at the signs and symptoms, so we can look at now how those STIs cause infertility.
So there is a correlation between STI and infertility, such that when an STI festers, or when you have a prolonged duration of having an STI without being checked or without being treated, it can actually progress to infertility. And that's bearing in mind, I'm really trying to be as basic as possible, but if you look at the, for example, in ladies, for example, if you look at the physiology of the reproductive system in ladies, there's usually the vagina, then the cervix, which opens into the uterus. The uterus further on opens to the fallopian tubes and the ovaries.
Yes, we'll insert a photo so that you can see what you're talking about.
Exactly. So when someone has an STI, more often than not, the vagina and the cervix are usually, the bacteria usually resides mostly in the vagina and the cervix. So if you have an STI which is untreated for a longer duration of time, the bacteria actually progress further inwards in the reproductive system, rather, into the uterus, further into the fallopian tubes and ovaries. And what it does is that it predisposes you to something which is called the pelvic inflammatory disease. So maybe Linda can shed some more light on that before I can continue delving into the matter.
So basically, pelvic inflammatory disease, it's a disease that is characterized by mostly abdominal pain. So you're a female, you'll start feeling a lot of now the abdominal and pelvic pain that I had said. And this mostly happens when there's an inflammation or a swelling in your reproductive system, and it's triggered by other factors other than STIs. So basically, when you go to a doctor, you'll just tell the doctor, I have like frequent abdominal pain. That will be the major sign that you'll have, and then you'll have other symptoms like nausea and vomiting, fever, the pain during the sexual intercourse, pain during urination. All those will come up. So if you have those symptoms, you could consider going for a checkup for pelvic inflammatory disease.
Thank you for that. So once someone has developed the pelvic inflammatory disease, it's just as derived from the name, it's characterized by inflammation. So once the tissues in the reproductive system, specifically the tissues lining the uterine wall and the fallopian tube are inflamed, there's healing that usually occurs after an inflammation process. So once those tissues heal, there's a lot of scarring, probably the normal formation of a scar. So once those scars are formed, depending on the consistency of the scars, it could lead to either blockage of the fallopian tube, or it could lead to narrowing of the pathway where the ovum or the fertilized egg passes through. So that could lead to, for example, ectopic pregnancy. So you're not able to, the fertilized ovum is not able to move into the uterus so that implantation occurs. So implantation actually occurs in the fallopian tube. So implantation in an ectopic pregnancy, as opposed to what is expected ideally, implantation should occur in the uterus. But because of the formation of the scar tissues, the fertilized egg is blocked from progressing into the uterus for implantation. So the implantation occurs in the fallopian tube, leading to tubal pregnancy or ectopic pregnancy. Another way it could also lead to infertility is once the fallopian tube is fully blocked, an ovum is released from the ovary, but then it doesn't progress or proceed into the uterus, or it does not give it enough space to allow fertilization by a sperm. So that means one is not able to conceive, not because the ovum, the eggs of the ovum are not viable, but because of the tubal blockage. So that's how it actually, in a nutshell, proceeds to infertility. But then when you're looking at the case of men, most of these sexually transmitted infections are associated with something called epididymitis. So probably just to break it down further, Linda will share a photo of the same. Epididymis is the organ that is involved with storage of sperms. So once it's characterized by inflammation, the epididymitis, it means that the sperms that are stored in the organ are sort of compromised because of the inflammation, plus there's also scarring. So it also interferes, at some point it can also interfere with the tubal transportation of the sperms from the epididymis to the prostate gland. So it actually impairs the entire process. So that's just in a nutshell how it can lead to infertility. Yes.
So guys, you've seen the way like actually sexually transmitted infections can cause infertility. And actually I was looking at another study. It was saying that the most cause of infertility in Africa, it's actually sexually transmitted infections, and it's not the other things like endometriosis, PCOS. Those are just a small number of the population, but the highest population, it's due to sexually transmitted infections. So you can actually see the magnitude of that. And what I'd advise is, we can now go to the preventive ways. How do I prevent myself from getting an STI? And then we finish with treatment. So prevention methods. So the first one, you can actually use a condom. Always use a condom. It's as in, I don't know how to put it, but the condom is the cheapest. When you look at the discussions I had on hormonal contraceptives, they're the cheapest. Unaweza pata ya 50 bob. So it's a good method of family planning, and it won't affect like your hormones and everything. It's the cheapest. Though I know most guys don't like condoms, but it's better safe than sorry. And then when it comes to also a mode of prevention, you should not have you should not have multiple sexual partners, because you see, when you change one partner to another, maybe I have chlamydia and it's not showing, then maybe my boyfriend has gonorrhea and it's not showing. So you see that mix up, and then you move from your boyfriend and girlfriend, then maybe you have 2 side chicks, and then the circle continues. So you see, you're spreading actually STIs from all of you in that circle. So it's important that you actually have just one partner. I know sometimes it's hard, but just have one partner, it's okay. And then the other thing is just abstain. I mean, it's the safest way. Abstain. You won't get HIV, you won't get gonorrhea, you won't get all these diseases. Achana nayo, it's for married people. So on a light note,
So in short, we beseech thee, abstain, to use condoms and practice safe sex, and to just stick to one sexual partner.
The ABCs.
Anyway. Okay, so also in addition to that, especially for the ladies, when it comes to vaginal health, the foods that you ingest, for example, can either predispose you to a fungal infection or a bacterial infection. So it's really key for you to ingest foods that have a lot of lactobacilli, which is actually the normal vaginal flora. Because you see, when the bad let me use the bad flora outgrow or the bad bacteria outgrow the good bacteria, it means one, it predisposes you to even getting another infection. And we've said gonorrhea and chlamydia are bacterial infections. So you see, if your vaginal health is at stake, you're eating probably foods that are rich in sugars, which are promoting a fungal overgrowth. It puts you at a greater risk of getting an STI as opposed to someone who the diet is okay. So that's just, I think, for the ladies. Please take yogurt. You can also,
a lot of water.
You can try cranberry juice. It's good, especially for the UTIs. So that's something that you just want to be keen on. Also in the spirit of just taking care of your reproductive health.
So that said and done, you can go to the treatment options.
When it comes to treating the STIs, it actually depends on the causative organism. So as Linda mentioned, HIV is virally transmitted, so you need antivirals. Chlamydia and gonorrhea are bacteria transmitted by various bacteria. We won't go into the names of the bacteria, but they're transmitted by bacteria. So you'd want to give someone an antibiotic that works against the bacteria. So I'll probably just mention something on gonorrhea, then Linda can take us through how to treat chlamydia. It's usually treated by a course of antibiotics. So you get a start dose. A start dose is one injection of an antibiotic, which is followed by a 5-day regimen of an antibiotic. So after the course of antibiotics, you should not be experiencing any symptoms then. So should you be experiencing any symptoms then, it warrants another visit to your gynecologist.
And to add on that, it's really important that they take a culture, like they take a swab and then they just culture it. This is important because it will help in determining the type of treatment you're going to be put on. Because you might find that one bacteria is resistant, like it doesn't respond to treatment for one antibiotic. So if you go and buy like antibiotics over the counter when you're feeling those symptoms, they might not help you. So one quick question before we conclude. There's usually, like, someone asked me, if I already am infertile, like if the STIs have already progressed to the time of infertility, can that be reversed? And can I give birth like after that?
Before I answer that, let me just shed some more light to what Dr. Linda has shared concerning a swab or a culture being taken. So self-prescribing is not something we would want to encourage because you see, let's say I'm sample A, Dr. Linda is sample B. A swab has been taken from Linda, a swab has been taken from me. Depending on what she has, the bacteria she has could be sensitive to a specific antibiotic, let's say antibiotic A, and resistant to B. Well, for me, it could be sensitive to B and resistant to A. So that's why self-prescription is not something you can consider, because you can decide to copy what Linda has done in treating an STI, while yet what you have is resistant to the specific drug that she has taken. So that's why it's also keen to get your own test results and also just see what happens from there. So to answer a question on infertility, when one progresses to infertility, it's actually not possible to reverse it, because one common thing with the STIs is that by the time they're leading to pelvic inflammatory disease, and which further leads on to infertility, it means it has actually propagated, and it has also caused other, it has disseminated and caused other damages to the organs and the system. So once scarring has occurred to your fallopian tube and your uterus, it's actually impossible to reverse it. So one may need to consider other modes of conceiving or other modes of progressing towards the same, but Linda will share on that. But then if someone has an STI, a newly diagnosed STI, there is hope, because there are actually drugs that can treat, just as you shared earlier. So that's something that can be stopped. So that's why it's really important for everyone to be keen on their sexual health. If you notice something off, there's nothing about being ashamed about your sexual health, that someone will think this of me. That's your sexual health, and you should always think of the road towards infertility. Sorry to bring it out that way, but you should always think of the road towards infertility. Would you rather be treated short term, or would you rather battle with something that is reversible, and we start thinking of other options that probably may not be viable to everyone? So that's just something you can do.
The thing is, stay safe, take care of yourself. If you can prevent yourself from getting an STI, please do. It's better safe than sorry. So to conclude, Thank you so much, Doc, for coming. Thank you for this video, and please make sure you subscribe, make sure you like. Let us interact in the comment section. You know, this is how we want to start earning money. So please subscribe, please like, share, and leave a comment. Thank you. I'll see you in the next video.
Okay.
Bye.
Bye.